Hello everyone, I welcome you to your favorite health program on the internet, the Health Center with Ozion at Kunie. Today I bring you the topic hepatitis. Yeah, hepatitis is a topic on the lips of many people and I want to treat it with you today. What is hepatitis? Hepatitis is simply the inflammation of the liver. Yeah, when your liver gets inflamed, that is called hepatitis. And what could make your liver to suffer from hepatitis or inflammation? One is alcohol. Alcohol, yes. Continued or sustained intake of alcohol can cause you hepatitis. Another thing that can cause you hepatitis is medicines or medications. What kind of medication is very guilty about it? You can say Tylenol, acetaminophen. Yes, it can cause you hepatitis. Maybe there are some other medications, but this is number one. I will have to present to you here. Then another thing that can cause you hepatitis is virus. Yes, virus will cause you hepatitis. Can cause you hepatitis. Different types of virus. But there are ways this virus present that makes us to categorize this in different ways. 5 ways or 5 categories. We have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Yes, when it is virus, the categories are these 5. Why? Because they present differently. Hepatitis A is the kind of hepatitis that you get through your mouth or anus, which means what you eat, or even where you went to, pass your feces. Depends on the location where you are. So it could cause you hepatitis A. So how does hepatitis present generally before I continue with the rest of hepatitis? Hepatitis comes with pain. It comes with making you feel very light in weight, making you feel like you're not hungry anymore, denying you hunger, appetite. Also, that means you'll be losing weight as well. So it comes with pain in your stomach, especially this right side of your stomach, which is where the liver is. And then when it is pain, it can transmit. So some other symptoms as you see on the screen are symptoms of hepatitis. So no matter the hepatitis, whether it's A, B, C, D, E, it comes with these symptoms. So A, I have told you where it comes from. B comes from fluid, especially blood or semen, so which means you can get it from sex. Hepatitis C is equally from blood, but most often, the guilty place is what you get it from the hospital or wherever you're using syringe, IV drugs, which means those who are doing drugs, those who inject themselves can get hepatitis C. Hepatitis D is just like B, gotten from blood, the infection of semen, sexual explorations and the rest of them. Another thing is the hepatitis E. Hepatitis E is just like hepatitis A, oral fecal. So these categories help us to know what kind of hepatitis that one is suffering from. And these symptoms mentioned are there. But when it's hepatitis A, it's just acute, that it would not need to, it doesn't really take a long time. Sometimes it solves or treats itself by itself. The inflammation will just happen and after some time you get yourself back. But you will need, you will need a vaccine for that hepatitis A if you haven't gotten it. Yeah, you will need a vaccine for hepatitis B if you haven't gotten it, and as well as the immunoglobulin that is what you use to treat it. These are not what you just do. Go to the hospital and you will be directed on how to get this done and when. Then hepatitis C does not have any vaccine. Hepatitis D is, like I said, is like B, and E is just like A. So the thing is this: when these symptoms are there, what do you do? How do you know? There is only a symptom of your eyes getting yellow and your stool being yellow, because when anything is happening in the liver, it has a lot of things to do with the yellowish of the eyes. Why? We have to talk about the function of the liver. The liver helps you in storing glucose or sugar and as well as releasing it when necessary in your body. The liver is very good for your body in breaking down the red blood cells that is already not in use and convert it to what we call the bile acid, which stores temporarily in your gallbladder, which is by the side of the liver, and that helps in digesting fat in your small intestine. You see, very useful organ. So when this bile acid goes to the intestine, it helps in digesting fat. And when you have any problem in your liver, this bile acid, the duct gets blocked, and the yellowish thing goes into your blood and begin to manifest in your eyes, and if it's sustained, to even begin showing on your skin as yellow. So when you see someone who's having yellowish eye, suspect the person has a liver problem. Don't go to any other place until it is confirmed. What else does the liver do? The liver also helps you in your blood clotting. Yeah, it helps in producing what helps in your blood clotting. When you have vitamin K, that is where it goes to synthesize and help your body in clotting your blood. What else does the liver do? The liver is very good in converting ammonia, because when it produces ammonia through your protein, it converts it to urea, and when that urea is passed to your kidney, which is now converted to urine, which means these proteins in your body are being utilized by the liver in processing it and getting it out of your body, because the ammonia at an increased level in your body will cause you more damage, especially in your brain, what we call the hepatic encephalopathy, a very big problem that makes someone very confused, and equally a lot of problems that when we discuss it as a disease. And when the liver has a problem that becomes very very complicated, it will cause you what we call cirrhosis, the scarring of the liver. This is no more inflammation, it means it's scar. So that is another topic we will discuss when we discuss the Imbeku. So now, this condition, hepatitis, will need to be treated, right? Yeah. And the treatment is, as I have said, the first one, A, can settle on itself. If it's not settled, you will then need to see your doctor for the right medicines to be taken, but you will still need a vaccine to protect yourself from certain infections as it continues. What of when it is not these viruses, that is alcohol? Sure, the treatment has to come with medicines prescribed by your doctor, but just to know the symptoms that I have mentioned. But look at the screen and you see the rest of the questions you may ask. But I would like to meet you in the comment section so it can be more interactive as we discuss what and what you will do to ensure that you don't just have these diseases, and as well that you protect yourself when it comes and equally treat them. I remain your regular host and anchor on this program, and I love being with you always to answer your problems and your confusions or whatever you want me to answer, and then to ensure that we all enjoy that slogan we say, that health is wealth. Thank you for having me today. I'm happy today. Have a good day.